Hello and welcome back. I'm just kidding. All right. The blood, lymphatic, and immune systems. Case report. You are a medical assistant employed by Susan Lee, MD, a primary care physician at Forwood Medical Center. Miss Lisa Sosin, a 37-year-old woman who presented a week ago with fatigue, lethargy, and muscle weakness. A physical examination revealed paleness, pallor of her skin, a pulse rate of 90, and a respiratory rate of 20. Dr. Lee referred her for some extensive blood work. She also determined that Mrs. Sosin had been taking aspirin and NSAIDs, non-steroidal anti-inflammatory drugs, for the past 6 months for her lower back pain. Mrs. Sosin's laboratory reports show an iron deficiency anemia. You are responsible for documenting her examination and care. The health professionals involved in diagnostic and treatment of problems with blood, lymphatic, and immune systems include the following. Hematologists. Hematologists are physicians who specialize in diagnosis, treatment, and prevention of blood and bone marrow disease. Immunologists and allergists are physicians who specialize in immune system disorders such as allergies, asthma, and immunodeficiency as autoimmune diseases. Epidemiologists are medical scientists involved in the study of epidemic diseases and how they are transmitted and controlled. Medical or clinical laboratory technicians perform routine testing procedures on body fluids, bloods, and other tissues using microscopes, computers, and other laboratory equipment. Immunology technicians are certified laboratory technicians with a special interest in immunology who generally work alongside medical research. Transfusion technicians are certified technicians who deal with all phases of blood transfusions. Phlebotomists assist physicians by drawing patient blood samples for laboratory testing. Components and functions of blood. The study of the blood and its disorders, the red and white blood cells within the blood, their proportions, and overall cell health is called hematology. A hematologist is a medical specialist who is trained in this area. Blood is a type of connective tissue that consists of cells contained in a liquid matrix. If a blood specimen is collected in a tube and centrifuge, the cells of the blood separate out and fill the bottom. 45% of the tube, 99 excuse me. Blood is a type of connective tissue that consists of cells contained in liquid matrix. If a blood specimen is collected in a tube and centrifuge, the cells of the blood separate out and fill the bottom 45% of the tube. 99% of these cells are red blood cells. White blood cells and platelets make up the remainder of the sample. The hematocrit, HCT, is a percentage of total blood volume composed of red blood cells. Plasma, a clear yellowish liquid that is 91% water, makes up the remaining 55% of the blood sample in the tube. Plasma is a colloid, a liquid that contains floating particles, most of which are plasma, proteins, nutrients, waste products, hormones, and enzymes are dissolved in plasma for transportation. When blood clots and the solid clots is removed, serum remains. Serum is a clear yellowish fluid that contains all the blood proteins not used in clotting and all the electrolytes, antibodies, antigens, and hormones that are carried in blood. Your blood travels throughout your body while performing a number of important functions. Your blood. Your blood maintains your body's homeostasis. transports nutrients, vitamins, and minerals from your digestive system and storage areas to your organs and cells. Examples of nutrients are glucose and amino acids. Transports waste products from your cells and tissues to your liver and kidneys for excretion. These waste products include creatinine, urea, bilirubin, and lactic acid. Transport hormones like insulin and thyroxine from your endocrine gland to target cells. Transport gases like oxygen and carbon dioxide to and from your lungs and cells. Protects against foreign substances including microorganisms and toxins. Cells and chemicals in your blood are an important part of your immune system's protective properties. Form clots. Clots provide protection against blood loss. Clotting is the first step in tissue repair and restoration of normal function. Structure, functions, and disorders of red blood cells, erythrocytes. Each RBC is a disc with edges that are thicker than and raised above the flattened center. This bioconcave surface area enables a more rapid flow of gases into and out of the disc. The main components of RBCs is hemoglobin, which gives the cells and blood their red color. HB is composed of the iron-containing pigment Hem bound to a protein called globin. The rest of the blood cells consist of cell membranes, water, electrolytes, and enzymes. Mature RBCs do not have a nucleus. Functions of red blood cells, RBCs, i.e. erythrocytes, are transport oxygen, transport carbon dioxide, and transport nitric oxide. Transport oxygen, O2, is in combination with hemoglobin throughout the body from the lungs to the cells. Transport carbon dioxide, CO2, from the tissue cells to the lungs for excretion, and transport nitric oxide, NO, a gas produced by the lining cells of blood vessels that signal smooth muscles to relax throughout the body. Disorders of RBCs. Anemia is a red blood cell condition where the number of RBCs or an amount of hemoglobin contained in each RBC is reduced. Both of these conditions reduce the blood's oxygen carrying capacity, producing shortness of breath and fatigue. The different types of anemia include iron deficiency anemia is the diagnosis for Mrs. Sosin. The cause was chronic bleeding from her gastrointestinal tract due to aspirin and other painkillers she was taking. Her stools were positive for occult blood. Other causes of iron deficiency anemia can be heavy menstrual bleeds or a diet deficiency in iron. Pernicious anemia, PA, is due to vitamin B12 deficiency. It is caused by a shortage of intrinsic factor, which is normally secreted by cells in the stomach lining and binds with B12. This complex is absorbed into the bloodstream. Without B12, hemoglobin cannot form. The number of red cells decrease, hemoglobin concentration decreases, and the size of red cells increase. Sickle cell anemia is a genetic disorder found mostly in African Americans. Here, the production of abnormal hemoglobin causes the RBCs to form a rigid sickle cell shape. The abnormal cells agglutinate, clump together, and block small capillaries. This creates intense pain in the hypoxic tissue, a sickle cell crisis, and can lead to stroke, kidney failure, and heart failure. Sickle cell trait is a minor form of this disease and rarely has any symptoms. Disorders of red blood cells continue. Hemolytic anemia is caused by excessive destruction of normal and abnormal RBCs. Hemolysis, the destruction of RBCs, can result from toxicity substances such as snake and spider venoms, mushroom toxins, and overdoses of drugs entering the bloodstream. Trauma to RBCs by hemodialysis or heart-lung machines or an incompatible blood transfusion can also cause hemolysis. Aplastic anemia is a condition in which the bone marrow is unable to produce sufficient new cells of all types, red cells, white cells, and platelets. It can be associated with exposure to radiation, benzene, and certain drugs. Polycythemia is an overproduction of RBCs by the bone marrow due to unknown causes. Types and functions of white blood cells. Leukocytes. Types of white blood cells, WBCs, can be categorized as granulocytes or agranulocytes. Granulocytes contain a granular cytoplasm made up of granules, which are sites for enzymes and chemical production. Granulocytes do not contain cytoplasmic granules. Granulocytes. Neutrophils, also called polymorphonuclear leukocytes, PMNLs, are normally 55% to 65% of the total WBC count, white blood cell count. These cells ingest bacteria, fungi, and some viruses. In neutropenia, the number of neutrophils is decreased. In neutrophilia, the number is increased. Eosinophils are normally 2% to 4% of total white blood cell counts. They leave the bloodstream to enter tissue that is undergoing an allergic response. In an allergic reactions, the number of and percentage of eosinophils increase. Basophils are normally less than 1% of the total white blood cell count. Basophils migrate to damaged tissues to release histamine, which increases blood flow, and heparin, which prevents blood clotting. Agranulocytes. Monocytes are the largest blood cells and normally 3 to 8% of the total white blood cell count. Monocytes leave the bloodstream and become macrophages that ingest bacteria, dead neutrophils, and dead cells in the tissues. Lymphocytes are the smallest white blood cells and comprise 25% to 35% of the total white blood cell count. Lymphocytes are produced in red bone marrow and migrate through the bloodstream to lymphatic tissues, lymph nodes, tonsil, spleen, and thymus, where they multiply. There are two main types of lymphocytes. B cells differentiate B cells differentiate into plasma cells, which are stimulated by bacteria or toxins to produce antibodies or immunoglobulins. T cells attach directly to foreign antigen-bearing cells like bacteria, which they kill with toxins they secrete. In a laboratory report, a differential white blood cell count, DIFF, lists the percentage of the different leukocytes in blood samples. Disorders of white blood cells. A normal cubic millimeter, MM3, of blood contains 5,000 to 10,000 white blood cells. In leukocytosis, the total WBC count exceeds 10,000 per cubic millimeter. Other conditions that increase the white blood cells count beyond the normal range include allergic reactions, which increase the number of eosinophils, typhoid fever, malaria, and tuberculosis, which increase the number of monocytes, and whooping cough, and infectious mononucleosis, which increases the number of lymphocytes.